Yes.
right? So tell me a little bit while we have 4 more minutes. How did you get into naturopathic doctor focusing on hormones and women's health?
Yeah, I was actually working at a lawyer's office before and thought like, "Oh, I wanna go the law school route." And then I found naturopathic medicine. I'm like, "This is exactly what I wanna do." Like, getting to the root
Yeah,
cause. And, like, I
yeah.
grew up, like, in a very conventional medicine zone, and this I just never, like I wasn't familiar with using herbs and homeopathy and all these other alternative choices. I'm like, "This sounds
Mm-hmm.
amazing." And,
Mm-hmm.
yeah, so that was kinda like, piqued my interest. And then I didn't really go like the science route in school, like so I had to do all the prereqs for all the pre-med stuff. And
Mm-hmm.
I loved chemistry and I loved all the science stuff, so it was just meant to be. And now I love helping patients.
I love that. I love that. Dr. Hendershot, while we have time, can you put your information in the chat so if people want to book with you?
Oh yeah. Hi to all my beautiful cooking soda.
Okay. All right. Perfect. So we're going to go ahead and get started with the conversation. I want to introduce the topic again. The topic is very much about women's hormones for the month of women's health, women's hormones, and the effects of hormones after having surgical removal of a reproductive organ. And this was very dear to me because I don't know if I've expressed to you, Dr. Hendershot. I actually had a my I always get this mixed up. Myectomy. Is it myectomy? Am I
Yeah.
pronouncing it right?
Yeah.
Okay. Where I had the removal of actually, and it was laparoscopic, and I had the removal of a fallopian tube and an ovary. And even with the level of knowledge that I had, I was still unsure how this will impact my organs. Um, I think I'm fortunate to have not only the support of, my colleagues, but also testing that it's not really readily recommended, okay, um, within traditional medicine. So I said, you know what, we need to have a more conversation about what does post care look like? Because all they told me was you can eat what you want to eat. Some indicators are you have to go to the bathroom, you want to wait for that full bowel movement. They explained to me how to take care of my scars, the wounds from surgery, but nothing else, to sustain myself. So this is part of the reason why I really wanted to have this conversation with
Absolutely. I'm so sorry. I didn't even know that you had that done.
you. Mm-hmm.
When
Mm-hmm.
when did you have that done?
That was in I want to say it's 2021 because time is moving so fast. But my whole journey with fibroids has just really ignited my passion with why I do what I do.
Yes. And so,
Yeah,
was there any conversation, like, when you had the consults and stuff around nutrition and how to best support you? I know.
of course not, right? Of course not. And rightfully so. I really don't know from a physician standpoint how much education they get around nutrition.
Yeah, exactly.
That's a
Yeah.
whole nother conversation. But there's typically, if you have that, one in every what, let's say I'm exaggerating, one in a million, in terms of doctors who will bring up nutrition. Nutrition still looks different for different people,
Yeah,
right?
definitely.
So I mean, although it helps to have a little bit more hands-on coaching,
Absolutely.
personalized
Yeah.
treatment.
And sometimes even for patients, like, just in general, like, after surgery, post-surgical, recommendations, I'll just always mention supporting the body, especially with no sugar, limiting sugar intake / no sugar,
Yeah,
because we know that causes inflammation in the body, and things that can support that tissue repair. So things like zinc and vitamin C are super
yeah,
important to help make the wound heal a little bit faster. Um,
yeah.
so just things like that can make such a big difference. And healing foods like bone broth, with all those supportive minerals in there that can make your journey a lot easier post-surgery.
Yeah.
you
Yeah,
know.
especially if you don't have much of an appetite, right?
Yeah, the bone broth is
Yeah.
great.
It absolutely is. It absolutely is. So, I do want to get into the conversation about, have you personally seen and worked with many women who have had some form of reproductive surgery? And what type of issues or conditions do you see in your line of work
Yes,
around
so
this topic?
I definitely have, and a lot of times, they've just been inundated in the conventional route, so they went that way,
Mhm.
and then instead of sometimes you can get to the root cause of this heavy bleeding, getting a stop to that, before doing the full-on hysterectomy, but, sometimes some of the common issues that can stem from it, would be hormonal imbalances, so this would be if both ovaries are taken, 'cause, you just
Mhm.
to menopause overnight. So that can definitely be, a consequence of getting the ovaries removed. Um, a lot of times, it just depends on why they're getting, if it's just the uterus removing that. So if there was painful intercourse before, then actually intercourse is okay after that. But or if it's full of fibroids and the uterus is removed, then a lot of that pain and the heavy bleeding is gone. But sometimes you can get some organ prolapse too after that. So I always recommend working with a pelvic floor therapist as well,
Mm.
strengthen that pelvic floor afterwards because you can get this pelvic organ prolapse or dysfunction. Um, and not to mention like some of the psychological effects that can happen, just like grief or if you're a little bit on the younger side, getting the organs removed.
Mhm.
Um, but definitely, yeah, depending on if one ovary is just removed, just the type of surgery that happens. One ovary is removed, like you still have the other ovary that can compensate for
Right.
making hormones. But if both are removed, that can definitely just catapult you right into menopause overnight,
Mm.
affecting mood and everything, skin health to bone health to cardiovascular health, because the ovaries are responsible for making your estrogen, progesterone, and testosterone. So yeah, it just depends on the patient, but yeah, just where they're at.
Can we dive into that? There's something that you mentioned, and I want to take the time to highlight this is you spoke of the mental aspect.
Yeah,
And I want to take the time to highlight and say that is where the command center of our hormonal network
right.
is within our brain. And I think we kind of overlook that part, right? That mental health. So like Dr. Hendershot said, having a counselor is actually, believe it or not, beneficial to your hormonal balance as well. For that very reason, those negative thoughts, those emotions impact your hormonal balance.
Absolutely. Like progesterone alone is responsible for kind of calming down the body. So take away the progesterone and you get anxiety, and
Mm.
testosterone is, the prefrontal cortex has testosterone receptors. So that can be like your motivation, drive, focus. Take that away, then you really don't feel motivated. So all these things could definitely have an impact on mental health for sure.
This is so good. Okay, so I have my questions here because I want to make sure we
Yeah.
address everything. So can you dive into a little bit when and I know you touched on it a little bit, when you have an ovary removed because you have your receptors within your ovaries, right?
Mhm.
Um, how does that impact, and you may have another one, how does that impact your hormonal flow as relates to your period?
Yeah, so usually if it's just one ovary, the other ovary will because we've got two ovaries. The other ovary
Correct.
sometimes sometimes it's good to talk about the basics too.
Yeah,
For med
absolutely.
school, I didn't know where anything was located. You
Okay.
know? So the two ovaries, so the one ovary can start to compensate for the loss of the other one. However, like I was saying, if both are removed, the abrupt hormonal changes overnight, can lead to hot flashes, mood swings, vaginal dryness, decreased libido. So all of those things that look like menopausal symptoms start to happen.
Okay, so okay, so for those who aren't aware, women and please clarify if need be, women are born. We have a set amount of eggs, right?
Yes.
And as one is removed, this is why I'm saying this because I will have a question coming from this. As one ovary is removed, that drastically cuts down our amount of eggs, right, for birth, right, to have children.
Right.
Um, can you kind of talk about how that impacts fertility in a way?
Yes, and so there are definitely even blood tests we can use and ultrasound to see like how many follicles, with the eggs maturing, like how many you
Mhm.
have. So AMH, anti-Müllerian hormone, is a hormone that you can actually test to see like egg reserve. It's not as popular now as it used to be to use that blood test, but and then ultrasound too can take a look and see like kind of what that looks like with the
Mhm.
left. Yeah. So we've got some, modern technology can definitely help. Um, but you could
Okay.
still only get pregnant with one ovary for sure.
So does that have some type of direct relation with your hormonal levels
Yeah.
in
So
any way?
well, like they'll start to produce more, and your adrenal glands are also responsible as well. So the little
Yes.
battery packs on top of your kidneys, and I do feel
Yeah.
like more people are becoming a little bit more aware of adrenals and adrenal savvy because it's talked about a little bit more now, which is nice. Like I talk to patients now, and they're like, "Oh yeah, I've heard about adrenals." I'm like, "Yeah." Like 10 years ago, nobody had heard about adrenals, but
I
your
know.
adrenals are responsible for making hormones too. So some good adrenal support and obviously nutrition playing a role. So all those things can help to balance that one ovary that's left to help balance it.
Okay.
Yeah.
Okay. So we're not looking at a regular, if one ovary is missing, we're not looking at irregular periods because of
No.
that one ovary is
Yeah, not
missing.
generally. And what has your experience been? Was your
Okay.
you're like, "Well,
Um,
Doctor."
it was a lot of trial and error for me, because like I said, there was no guidance with that. Of course, it was a lot of introduction of prescriptions like hormonal therapy,
Yeah.
but it's not the same hormonal therapy that we may recommend
Mhm.
within our practice. And one thing I do kind of want to talk about is actually getting into the causes, like of being on this medication, right? Because, for instance, I had a situation. I want to be brief because I want to make sure people get their questions in. But what ended up happening was I had a cycle that would not stop, and I was bleeding, and I was like on day 10, and it just was not letting up. So I made an emergency appointment, and they put me on a medication for progesterone.
Okay.
Okay,
Mhm.
which stopped it. However, because I got to be careful not to be so biased because I can be jarring with my statements sometimes. They tend to kind of hone in on the condition itself. And I say it's they kind of look at it as an isolated event. And of course, this is not all providers' approach, but that was my experience. And what ended up happening was I had a major contraindication on the medication that she put me
Oh,
on. And
no.
yeah. And so because many people now, it upset me because this is something that was literally right there. I had an underlying liver condition.
Oh.
And it specifically says not to be on if you have an underlying liver condition. And so when I started on the prescription, I started having night sweats that had my bed drenched. I had to change my covers every day, and I had already was kind of reading on the causes and effects of this medication, but then something told me to kind of go back and look at the leaflet itself and read and study it a little bit more. And I said, it said it right there. So I called her and I told her, and needless to say, she told me to stop it immediately, but that was the last time I heard from her. Yeah. So um
I think that brings
a
up
lot of
a
people don't tend to read those leaflets,
no, I think you bring up
not
such a good
early.
point to be like such
Mhm.
like an advocate for yourself. Like
That
you knew
part.
something was wrong, you did some research and you found what was going on.
Yeah. Yeah.
Oh, that's
Yeah. So that's one thing. We will have to have a whole nother conversation about my journey, but this is now you
oh,
see why I feel like this is so important to have.
absolutely.
Um, and let me ask this. When it comes to the uterus itself, can you kind of talk about how that affects the hormones as well if they have the uterus removed? Like having a hysterectomy.
Oh, like how well, because unless there's like fibroids in there, those can contribute to estrogen dominance. It's kind of like
Correct.
did the estrogen dominance cause the fibroids or did the fibroids cause the estrogen dominance? So, but there's no actual like hormones produced in the uterus. Um,
Right.
but a lot of times just getting the uterus taken out can have some benefits of if they're, just depending on the reason, especially if there was cancer or something, or fibroids, then taking out can relieve that pain, heavy bleeding. But of course, coming from a naturopathic standpoint, it's like, let's try to find the root cause first and see if we can
Correct.
help that way, and surgery as a last resort. Um, But yeah, so it just really depends on like the health of the ovaries, the for fertility
Mhm,
status, the one remaining.
mhm,
But just in terms of the just taking the uterus out by itself, won't
mhm.
as big of an impact as obviously taking the ovaries out.
Right, right, right. So more so it'll just affect childbirth, but not hormonal levels.
Yeah, exactly.
Awesome, awesome. Lastly, we're gonna stop with this because our time went by super fast.
Oh wow.
Um, but if you can give 3 practices, I did put in here pelvic floor, but 3 practices women can do to be proactive with their care after having surgery. What would that look?
Yeah, I would just say, like, really focusing on nutrition, which they can come to you for, because that is, like, the crux of everything, right? Like, the food is either gonna have you live a healthy life or go the opposite route. So a lot of, like, if there is estrogen dominance going on, like, avoiding those foods that are causing estrogen dominance, xenoestrogens, like the fake plastics, things like that, so really focusing on nutrition is so important. Um, and then also maintaining, like, somewhat a little bit of an exercise routine, whatever that may look like, whatever you're able to do, because keeping that blood flowing is so important, and that brings nutrients to these organ systems. Um, so I would say definitely, and mental health too. Exercise for your mental health, absolutely.
Oh,
And yeah,
can't forget about that.
and then just managing stress, definitely can, and whether
Okay.
that's through exercise or journaling or prayer or meditation, whatever that looks like, just to help that
That's
mental.
so good. That's
Yeah.
so good. That's so good.
Like
Okay, let
feel
me
like,
make sure I put that. You said exercising,
oh yeah,
prayer,
meditation, prayer,
meditation,
journaling,
yes.
because these
You hear
feelings
this? So
are, and we have to get them out.
yeah, there we go.
Yes.
Got it.
Oh, there we go.
Okay.
Yeah, yeah. Perfect. Yeah.
Yeah, I mean, journaling, I always say journaling really saved my life because
Right.
we don't realize as women how much we hold in just to be strong for everybody else. And of course, if we internalize that, continue to internalize it, it starts to manifest in other ways in our body because we don't have an outlet. So journaling really helped me in a major way, just to even see the state I was in because it wasn't clear. Of course, you have an idea, but when you're writing, it really brings clarity to the space you're in.
Absolutely. And even like there's some theories that fibroids, these walled off emotions can be,
Mhm.
these little pockets of emotions that the body stores. Like they're like whatever we're thinking up here can definitely get stored in the body. So
Yeah,
like I'm saying getting it on paper and processing it is so beneficial for the body.
yeah, yeah. I think I'm gonna do a post where I have to show people how their emotions really impact their hormones. Because if we think about it, you think about adrenaline, you think about epinephrine, serotonin, and
Yep.
they're very much related to emotions. So
Yeah.
these are emotions that are stimulated or hormones that are stimulated when we're feeling this, right?
Yes, like dopamine. Absolutely.
Yeah,
Yeah.
yeah,
Yep. Yeah. No, I think that would be so fun. That's a good one.
yeah, yeah, yeah. Well, Dr. Hendershot, I'm so grateful. Thank you so much
Oh, you're so
again
welcome. Yes.
for
I
sharing
love
this
chatting
space
with you.
with me. And if you want to connect with her, there is her, she's written her is that the website? Yes.
Yeah.
She's provided a link for you to connect with her. Is there any like ebooks or anything like that that you have that you want to share?
Oh, I used to have on my old website a link to the ebook, but I'll have to put that on the new website, on Ivy's website. There is an
Yeah,
ebook. Yeah, I
yeah.
forgot about that. Yeah.
And absolutely, we're going to make sure she has that next time we have her back. And lastly, I also want to share for those who are here, Skin Talks. Actually, it's called Sex Talk 101, what they didn't tell you in school. And it's about your hormones, right? And related to your menstrual. I think it's a great fundamental book to have. If it's too late for you, definitely gift it to someone or for your daughter, because knowing that hormonal flow is very important when it comes to self-awareness. Very important.
And nobody tells you.
I learned at 30. I'm ashamed. Like,
Until school, med school, I was like, I had no idea.
I know. Yeah, so you have that information. Thank you so much for joining. I'm so excited that you all came. Dr. Hendershot, thank you so much for sharing this space with us. We're definitely here to educate, support, empower you so that you can advocate for yourself. Okay. See you next time for the next chat and share.
Thanks so much. Bye.